Today we are going to learn the blood supply to the brain. But before we learn that, actually we have to know a little bit about the areas of the brain which is launching or accommodating the blood vessels. And many a times this is submerged as we go on the brain, go on the learning the surface of the brain. This part of the brain is, we do not have a clear idea. We learn the base of the skull, but we forget about the base of the brain. But actually this base of the brain is that house where these blood vessels are placed. So before we begin, we have a half an hour class today, short class. So we have to understand where these blood vessels are, the locations of the blood vessels, which is called at the base of the brain, and on the base of the brain is accommodating the blood vessels which is present. So this is familiar with you maybe, which I am just like projecting with the picture. We are seeing this base of the brain or brain from the lower side, just like you have seen the brain from the superior side, lateral side, cutting to corpus callosum to the medial side. This is an intact brain that you can see with the brain, and along with this particular part we call them as brain stem, and this part of the brain we call them as this inferior surface of the brain. Now inferior surface of the brain, if we divide it into two parts, we call them as orbital surface and tentorial surface. Now in the central part we see that this is a brain stem which is cut in here, and if you can see the optic chiasm which is crisscrossing in this particular point, and this particular area between this particular optic chiasm and this particular brain stem, we have a narrow area, we call them as base of the brain. Now we have to understand why this is important, because we have a vascular channel placed in this particular region, we call them a Circle of Willis. Now the importance and the significance of the Circle of Willis lies in here. It communicates the segment of the blood supply from the fore part of the brain and the posterior part of the brain. Now we will be coming into it, but little bit about this particular base of the brain which has this particular boundary. Sometimes we have given with a short note, apparently looks like this is a unnecessary short note given to it, like the boundaries of this particular base of the brain. But eventually they go to the blood supply to the brain, which starts with the Circle of Willis. So to begin the Circle of Willis, we have to know where this Circle of Willis is there, placed in the brain region. The Circle of Willis is present in this area which you are seeing here, we call them as base of the brain, and the content of the base of the brain, along with that the vascular content, is Circle of Willis. Now this is what we are seeing here, inferior surface. This part we call them as orbital surface, this part we call them as tentorial surface. So this green one you are seeing here is orbital, and this one which have got multicolor we call them as tentorial surface, sitting on the tentorium cerebelli. Now this tentorial surface have got grooves, sulcus, gyri. We are not going to learn those particular regions, but in between them we have this particular space, we call them as interpeduncular fossa. Now in the brain region, this particular interpeduncular fossa comes as a short note because that's the interpeduncular fossa. You have to know the boundary, and the important content lies in here is that Circle of Willis. Now this, what is interpeduncular fossa? This is, we are seeing here the optic chiasm which is limiting the anterior part, and the posteriorly we have this brain stem, we have this pons part or brain stem. In between this optic chiasm and this particular pons, we have this narrow region which you are seeing here. This region we call them as interpeduncular fossa, which is posteriorly or posterolaterally limited by this crus or cerebellar crus or cerebral crus, and anteriorly it is limited by this optic chiasm, and after the optic chiasm we have the optic tracts which is limiting the sides of it, and in the midline we see that this is the pituitary gland with the stalk, and posterior to that we have two bulges, we call them as mammillary body. In top of that we have a vascular channel present in here, we call them a Circle of Willis. So the Circle of Willis is sitting in this area of the brain or the base of the brain, we call them as interpeduncular fossa. We have to know what do you mean by interpeduncular fossa and the boundaries of it. Now zooming this particular interpeduncular fossa, there are 2 points present to it. One is over here, this region, side of this optic tract, we call them as vallicula. This region, we have this particular wide region, it is porous, it is having dots, and again in the back side behind this mammillary body it has small slits. Also we had poration or perforation. Now these perforations right side, left side, and the midline, we call them as anterior and posterior perforating substance. Now, this perforating substance, importance for us is that from this particular circle of Willis, the blood vessels penetrates, goes to the brain, supplies the substance of the brain internally. This means internally we have the basal ganglia, nucleus, thalamus, etc., or parts of the diencephalon. Through this particular pores, it runs through the blood vessels which is coming to the circle of Willis. That is what we are going to talk. So, if you just like zoom this thing, this is the circle of Willis which is forming in this particular region, has got like a boundaries, etc., etc. We will be coming into it. It is largely placed on over this region, we call them as interpeduncular fossa. So, that is why this interpeduncular fossa we just like do not read, we come to the examination, but it is a small thing. We read the circle of Willis, but fail to understand or fail to get the importance of the interpeduncular fossa, and it is a 2-mark short note, we cannot answer it properly. That is the point out here. And this is what circle of Willis is about, and this is what we are talking about. Now, what we call here is perforated substance. There are 2 such perforated substances are there. One is here, one is here. So, in between the pons and the mammillary body, we have a perforated substance, we call them as posterior perforated substance. By the side of this green line, over here, this region, we have the optic tract, by the side we call them as vallicula. By the side of the vallicula, we have another perforated substance, we call them as anterior perforated substance. What is the importance through it? Blood vessels penetrates this perforated substance and goes deep to supply to the brain. So, this is the pretext of understanding this particular brain and understanding this particular perforated substance to go into the main topic for the day, which is blood supply to the brain. Related to the blood supply to the brain, we do not have to learn a great depth on it. We have to understand how this particular brain is supplied blood with and what are the mechanism which is controlling or bridging between them. So, we have the CNS blood. So, the brain blood comes from 2 segments. We call them as anterior set and other one we call them as posterior set. So, there are 2 sets of supplying blood vessels are there. We call them as anterior and posterior depending on how they are placed. We call them as anterior set of the vessels and posterior set of the vessels. Now, in between them joining here we have a vascular channel, we call them as circle of Willis. So, this circle of Willis is sitting in between the anterior set of the vessels and the posterior set of the vessels, making a bridge between these two, so that this blood circulation between this particular brain remains uninterrupted and runs in a sequential manner. Now, what supplies the anterior set and what comes with the posterior set, that what you have to know. Now, this particular anterior set of the blood vessels which is coming in here is coming through 2 blood vessels. One is known as anterior cerebral artery and second one is middle cerebral artery. Now, this anterior cerebral artery and posterior cerebral artery, both of them are branch of internal carotid artery, ICA. Now, where ICA is coming? It is coming from the common carotid artery, which has another branch, we call them as external carotid artery, which supplies the head neck region, and other branch of common carotid artery, we call them as internal carotid artery. Internal carotid artery getting in the brain splits into 2 branches, we call them as anterior cerebral artery and the middle cerebral artery. Out of this anterior cerebral artery and the middle cerebral artery takes this maximum amount of the blood. So, if you get this blood flowing through 100 ml of blood which is flowing through this internal carotid artery, 80% distribution is going through the middle cerebral artery and only 20% of distribution is going to the anterior cerebral artery. So, this is how this anterior set of these blood vessels present in the anterior part of the brain. They are supplying this anterior half of the brain except this occipital lobe, that means this frontal lobe, this parietal lobe, the superior surface, the medial surface and as well as the inferior surface. Except this occipital lobe, this anterior set is supplying. Now getting to the posterior one. Now the posterior one also likewise this anterior and middle cerebral, they are supplied by two vessels. One is known as vertebral artery and second is we call them as basilar artery. So, these are the two arteries, vertebral artery and the basilar artery. They are supplying this or forming this posterior set of this blood network in the posterior part of the brain. What they are supplying? They are supplying the rest part of the brain, cerebellum, brainstem and the occipital lobe of the brain and the deep parts of the brain of course they are supplying like thalamus etc., etc. They are supplying these particular regions of the brain. We cannot remember the detail of this particular supply, but just like in a brief we have to remember. Now this vertebral artery, there are two vertebral arteries right and left, they join together, they form a common artery, we call them as basilar artery and this basilar artery splits into branches, we call them as posterior cerebral artery. So eventually this basilar artery gives to branch, we call them as posterior cerebral artery, which is the third artery as well, which supplies the network of the blood supply of the brain. Now bridging between this anterior set and the posterior set, between this anterior, middle and the posterior cerebral artery, we have a communication exists between them, we call them as Circle of Willis. So this is the network or the gross thing about the brain supply. So if you do not remember the detail of the branches of the blood supply to the brain is fine. So whatever the things are jotted over here regard to the blood supply, the anterior cerebral artery, middle cerebral artery, posterior cerebral artery and what constitutes the anterior set of the vessels and the posterior set of the vessels, we are good. So no more deep digging is required from here. So only the conceptual thing regard to this particular blood supply in the brain region that we have to understand. So anterior set, posterior set, in between them bridging is the Circle of Willis. Now the Circle of Willis takes the limelight because being a clinically very relevant structure, because it's easy to comprehend, for the easy to give that to test in examination as well. And as I am saying, this is sitting in the middle portion in the interpeduncular fossa region. So if this thing is not there, there is no communication between the right half of the brain, anterior half of the brain and posterior half of the brain. So there will be no blood flow between these particular segments of the brain. That's why this Circle of Willis sits into a prime position. So middle guy, which is the important blood vessels related to this particular segment. So that's why we learned the detail of it, but not conceptualizing this anterior set and the posterior set. They are also or the important things for the brain. Now, if you have learned from this point, there another basic concept about this particular blood supply of the brain that you have to know. So we getting this particular anterior set and the posterior set and the Circle of Willis, which constituting of three major vessels: anterior cerebral artery, middle cerebral artery and posterior cerebral artery, and a communications between them, which is known as communicating branches between them, which is coming in between in the middle portions, forming the Circle of Willis, which is sitting in here. So eventually getting three blood vessels: anterior cerebral artery, middle cerebral artery and posterior cerebral artery. So eventually we are getting these three major arterial which is coming in here. So all these arteries in the brain region, they sit or seed two sorts of arterial branches. So from each of them, like anterior, middle and the posterior one, they basically give rise or branch into two basic form of arteries. So they give two arteries from each of the segment. One of them is penetrating, going deep into it. We call them as central branches. So they give or penetrate deep into this, and their end arteries goes in the substance of the brain. We call them as central arteries. They go in the central portions of the brain and supplies to it. And the second branch, we call them as cortical branches. Now these cortical branches remains on the surface of the brain, the visible surface of the brain that we have seen, the superolateral surface, the superior surface, the inferior surface, the tentorial orbital surface. So these are the two sets of the arteries that is coming from these three sets of arteries. We call them as central branches, and as well as other branch we call them as cortical branches. Cortical branches are superficial, and the central one is deep penetrating branches. Now deep penetrating branches, how do they penetrate the brain? They penetrate the brain through these perforated substances that we talked about in the beginning, anterior and posterior perforated substance. So anterior perforated substance and posterior perforated substances, through them they largely get into the substance of the brain, and eventually they supply these particular deep areas of the brain. So this is how this whole network of the brain blood supply is lying in. So there are some branches, they are coming from this anterior, middle or posterior cerebral arteries. They are remaining on the surfaces. They are known as cortical branches. They are perpendicularly growing or just penetrating the surface and remaining there. And other one penetrating the deep into the surfaces through the perforated substance, goes deep. So if you cut the brain, if you cut the corpus callosum, you get this particular cavity there, we call them as lateral ventricle. If you cut the lateral ventricle in a slice, we get this area, we call them as diencephalon on the brain, where you find the basal ganglia nuclei. We are slowly going to learn that, where this Parkinsonism related or controlling or movement controlling ganglions or the cell bodies are present. So these deep areas, just like thalamus, the thalamus or pulvinar or amygdala, they are deeply placed nuclear, they are present in these particular diencephalon regions. How they get this blood supply? They get the blood supply from this penetrating deep central branches. How these branches are coming? They are coming through these particular central arteries. Now these central arteries that we have mentioned, they are of two basic types. Branches, S-T-R-A-I-T, or thalamostride branches. And the second one, we call them as thalamo-geniculate branch. These are the two major branches. There are several branches that are coming to or they are going into this particular central branches. 6 sets of the arteries are there, they are going in. Out of that, 2 of them will be coming to you, surfacing there frequently when you are studying them. Some of them we call them as stride branches, and some of them we call them as thalamo-geniculate bodies. So these 2 words, they are coming. If you remember this, fine. If you do not remember this, is even fine, right? But you have to know this basic thing: anterior cerebral artery, middle cerebral artery, posterior cerebral artery. They are giving 2 sets of branches basically in gross in general. We call them as deep penetrating arteries. We are known as central arteries. And they have the superficial branches. They remain on the surfaces mostly. Perpendicular branches are coming from it. They are making anastomosis, maybe some of them. They are known as cortical branches. And this, out of these deep branches, they penetrate this particular perforated substance which are present in this particular base of the brain. And once they penetrate the brain, there are 4 or 6 different branches are there. Out of them, 2 of them are important. We call them a stride branch and thalamo-geniculate branches. We will be surfacing this. So this is how, this is what we are going to talk about, the arterial system. So anterior system, posterior system. Posterior system also known as Vertebrobasilar. Anterior one, we call them as carotid system because they are coming from the internal carotid artery. And bridging between the anterior and posterior, we have this zone which is sitting in the green zone. If we do not have this Circle of Willis interpeduncular fossa, we do not have a complete blood supply to the brain. It will be interrupted. So this Circle of Willis takes the limelight of it because having a centrally placed, making the negotiation between the anterior half and the posterior half. Now coming to the system of the anterior one that we are talking here, we have this internal carotid artery going to the petrous part of the temporal bone and running in a horizontal part, then it's coming up this carotid canal to the brain. Once it reaches to the brain, it enters to this particular skull bone. Over here we have this particular sphenoid bone and the sella turcica side of it. It pierces this cavernous sinus roof and then makes a siphon. Once it makes a siphon, it splits into two branches, anterior cerebral and middle cerebral. So from this particular carotid artery, this particular artery which is sourcing onto two parts. One is anterior cerebral, this is how this anterior cerebral is coming, and then we have the middle cerebral. This one which you are seeing here, this middle, we call them as internal carotid artery. So this internal carotid artery splits into two branches, anterior and posterior. Posterior or the middle one which is coursing back. You can see the volume of this middle one, right? The middle cerebral artery, MCA, and anterior cerebral artery. Anterior cerebral artery is the skinnier one. So that's why I am saying this one, middle cerebral artery, is taking the 80% of the blood supplying to the wrist part of the brain, whereas anterior cerebral artery is taking 20% of the blood which is flowing through the internal carotid artery. And between this internal carotid artery, we have this anterior carotid artery which is communicated with these anterior communicating branches like this. And then we have the posterior communicating branches which is communicating through the Circle of Willis. This is where the Circle of Willis is formed and which is communicating with the Vertebrobasilar system. So this is, we will be narrating in. So this anterior cerebral system or anterior system which you are seeing here, this is which you are seeing here is a branch which is coming from this particular middle cerebral artery going into different parts and branching in and remaining in the superficial parts of the brain. These branches which are visible superficially, we call them as cortical branches. So this is remaining superficial. Once you open the brain, these branches are visible. That makes this particular branch a superficial branch. These superficial branches, we call them as cortical branches. Now these cortical branches, as they are present in different area, we call them as callosal branches, hippocampal branches, etc., etc. We do not have to remember the names. Only thing we have to know this superficial branch and penetrating branch. If you forget about this particular cortical name, don't worry about it. Just know this superficial branch and penetrating branch, perforating substance which is guiding them. That is good enough. So this anterior cerebral artery that we are seeing supplying this particular part of the brain, starting from this frontal lobe, parietal lobe and this calcarine sulcus up to that part, it is supplying these particular regions. So anterior set which is basically supplying up to this part which is present in this region. Up to this, or posterior to this calcarine sulcus, we have this particular vertebrobasilar surface or this posterior network is supplying to it. So this is what we have supplied through this particular anterior cerebral artery. Now this anterior cerebral artery, that's what I am saying, cortical branches, that is remaining superficial. Once you remove the brain, you can see them. Deep central arteries, they are going through the perforating substance. Out of these deep branches, one of the important branch which call them as artery of Hofner, which is related to this particular caudate nucleus or basal ganglia nucleus. So once you learn the basal ganglia nucleus, you learn the blood supply which is coming from this middle cerebral artery which is known as Hofner branches, which is a central artery. If you remember the Hofner artery, fine. If don't remember that. So this basal ganglia is basically supplied by this particular anterior cerebral artery which is a part of diencephalon or mid portions of the brain. Then the branches which are present from the anterior cerebral artery, you do not have to remember. Only thing that you have to remember, it sits a branch, we call them as, it sends a branch which is known as choroidal branch. Somewhere it is maybe showing somewhere which is known as choroidal branches or anterior choroidal branch. Now this choroidal branch matters to us because that is related to the formations of the CSF. So when you are going to learn about the CSF formation, they will be mentioning a word choroidal branches which is making the telachoroidea, which is basically producing the secretions in the CSF. So these choroidal branches, they are coming from this anterior cerebral artery, we call them as anterior choroid or anterior choroidal branches. They are present in this particular region which is somewhere it is showing. If I get a picture, I will show that later on maybe. So other than this, these branches of the anterior cerebral artery you do not have to remember, you do not have to memorize. So these branches which are coming from the middle cerebral artery also you don't have to remember. It splits into anterior division, posterior division, and then it gives into these several different names. The individual names of the cerebral artery we do not have to know. Only the basic divisions you have to know. Cortical branch, which is superficial, penetrating branch, which is known as the deep branches. That's what all of these arteries is giving these two sets, and eventually they supply this. Oh, this is what you are referring at, choroidal artery, anterior choroidal artery, which is coming in here. They are related to the stella choroidea. Once you learn these particular ventricles in the brain, in the ventricles of the brain, you will find some kind of like cushion-like substance hanging. We call them as stella choroidea. Within the stella choroidea, we have some arteries, we call them as choroidal arteries. What do the choroidal arteries do? They make a plexus there, and through the plexus, the CSF are produced or secreted from this particular villi which is present to it. So then they will be referring to these particular choroidal arteries. So these choroidal arteries are branches coming from the middle cerebral artery, anterior cerebral artery, posterior cerebral artery. If they are coming in a different direction, anterior choroidal artery, middle choroidal artery, posterior choroidal artery, likewise they are named. So this middle cerebral artery takes this particular maximum loads of this, and these branches which you see here, we call them as striate branch, also known as lenticulostriate branch. What do they supply? They supply this particular region, we call them as internal capsule region, and also known as this diencephalon region and base of the brain region. So this region which you are seeing here, we are going to show that in a practical classes, cutting in the middle and making a horizontal section. So this region which you are seeing here, this is the ventricle cavity, which is lateral ventricle. By the side of the lateral ventricle, we have these different nuclei. We call them as caudate nucleus, globus pallidum, lentiform nucleus. This nuclei over here surrounding this particular middle portions of the brain, we call them as basal ganglia. This basal ganglia basically controls the finer movements of our body. So this finer movements which is coming from here is calibrated finally by the cerebellum, and we make a movement whenever you are walking, whenever you are talking, whenever you are making any motor actions. This basal ganglia is responsible for it. If you have a disease of the basal ganglia by some kind of neurochemical error, which is a common disease we learn here, is Parkinsonism disease or Parkinson disease. So if you have a Parkinson disease, we have the basal ganglia nuclei is diseased. Maybe we have this particular striate or lenticulostriate branches, which is deep penetrating arteries, maybe just not producing enough blood, or may have some kind of chemical insult, or may have some traumas which is related to the basal ganglia nuclear disruption, which leads to a disease we call them as Parkinsonism. So in physiology, they teach about the Parkinsonism neurophysiological functions. They will be referring to the basal ganglia nuclei. We will be also going to teach about the basal ganglia nuclei, and we will be narrating these names. We call these branches as lenticulostriate branches or striate branches. So these striate branches, they are penetrating branches coming through the perforated substance, reaching in there and supplying the middle portions of the brain. We call them as basal ganglia. Along that, we have a white fiber running in here. We call them as internal capsule. Internal capsule comes as an exam short note. We have this convergence of the fibers which is coming from the brain, going to different areas, brain to cerebellum, brain to spinal cord. We call them as corticonuclear fiber, corticospinal fiber. They are traveling through this white matter fiber. We call them as internal capsule. This internal capsule also receives the blood from these striate branches. So these striate branches, which is penetrating deep branches, matters to us. We do not have to know where from these branches are coming or which artery or exact name of this particular artery which is supplying to it. If you do not remember, just remember these striate branches or lenticulostriate branches, which are supplying the basal ganglia and internal capsule. So largely what we see, the middle cerebral artery takes the maximum load of the arteries. Now what happens over here? If you have a disease of this blood vessel which is middle cerebral artery. So if you have this middle cerebral artery either not flowing blood properly or may have ruptured. So if this middle cerebral artery ruptured because of the severe blood pressure, we call them as severe hypertension, that leads to a neurological condition. So we call them as CVA, cerebrovascular accident. In layman's term, we call them as brain stroke. So what happens in the brain stroke, which commonly affects this MCA, That means the middle cerebral artery is knocked out, not flowing any blood. It has a hematoma form. That leading to this particular problem with the basal ganglia, that leading to the problem of the internal capsules and so many areas of the brain which is supplied in this MCA terrain or domain. So, we have the hemiplegia or aphasia or any kind of movement error depending on how extensive that particular bleeding is and how extensive that thing is coming. So, this is the significance of knowing this particular striate branch which commonly ruptures, this striate branch commonly bursts open and leading to the hemorrhage to this particular site, the basal ganglia hemorrhage, etc., etc. So, this particular thing matters to us about this arterial network and arterial systems. So, this is we learned about the middle cerebral artery. You can see these middle portions of the brain that is supplied through this middle cerebral artery. Now, coming to this particular middle cerebral artery, it supplies this particular so many areas. It supplies the auditory areas, Wernicke's areas, supramarginal areas which controls this particular area which is cortical areas. It gives the branches which is going to supply this particular region which is eye field regions. So, this particular area MCA, if it is damaged or if it is not flowing blood, we have so many problems to these particular patients related to the cerebrovascular accidents. Now, coming to this particular arterial branches that we refer here is lenticular striate branch that we mentioned several times, also known as striate branch. They are supplying this particular region, we call them as this basal ganglia and the internal capsules. Coming from this middle cerebral artery, we are going to talk about the posterior system or known as vertebrobasilar system. Now, what happens to the vertebrobasilar system? We have an artery which is coming from the base of the brain to this particular region. We have this artery which you seeing here, we call them a spinal vertebral artery, which is right vertebral artery, left vertebral artery. Where from vertebral artery is coming? This is an exam question they ask about. So, we have this subclavian artery which is coming from this particular arch of aorta, right side, left side, from the subclavian artery. We have this particular branch which is coming in the first part, we call them as vertebral artery. What do the vertebral artery do? It shoots in the upper side or goes vertically and enters to this particular foramen transversarium by this particular lateral side or transverse foramen. You see that in this particular vertebra in the cervical region, we have a foramen. It enters to this particular foramen transversarium of the 6th cervical vertebra and runs vertically. Then it comes out of the C1 cervical vertebra and has this part which is called as basioccipital part that goes to this particular foramen magnum, and once it goes to the foramen magnum, enters to the brain, and the right side vertebral artery, left side vertebral artery joins together and they form a middle artery, we call them as basilar artery. So, this is how these things are formed. This is right vertebral artery, left vertebral artery joining here and forming a middle artery, we call them as basilar artery. And this basilar artery splits into two terminal branches, we call them as posterior cerebral artery. So, this basilar artery, posterior cerebral artery, and a part of this particular anterior spinal artery forms this network from this posterior system. We call them as vertebrobasilar artery. Vertebral artery and the basilar artery, which eventually gives rise to the terminal branch, we call them as posterior cerebral artery. So, what we have to remember out here, what is vertebral artery and the branch of vertebral artery? Vertebral artery enters to this which foramen, which is an MCQ, they ask about. Through this which vertebral foramen, they enters to this particular vertebral lateral channel, and after that, what happens to this particular vertebral artery? It forms a common artery, we call them as basilar artery. What happens to the basilar artery? It splits into two terminal branches, we call them as posterior cerebral artery. So, this thing that we have to know about. Vertebral artery sends some branches, we call them as anterior spinal artery, posterior spinal artery and cerebellar artery. We has got anterior, posterior, inferior cerebellar artery which is going to supply the cerebellum. We will be coming back to this particular part. But again, this particular branches part, if you cannot remember, do not remember, do not worry about it. So, remember this vertebral artery, the basilar artery and terminal branch of the basilar artery which is known as the posterior cerebral artery. And this particular thing is forming the posterior set of the arteries. Now, this posterior set and this anterior set is communicated with it, and this is the circle of Willis, this is how it is formed. So, this particular basilar artery sends some branches as well, we call them as pontine branches, gives to the pons, it goes to supply the cerebellum, we call them as superior cerebellar and inferior cerebellar. Inferior cerebellar have got two branches, anterior and posterior. and then we have this branch, we call them as labyrinthine branch. It goes to supply the inner ear. Do not remember this, know this particular name, basilar artery, where from this artery coming. The sub branches of it, just let go. So this is how this particular network of the arterial system goes to supply this particular cerebellum, and the brainstem supply to this. On the top of the cerebellum, you see that this particular nuclear mass is sitting. This is known as thalamus. This thalamus, along with the top of that, we have the epithalamus. They are supplied by the posterior set through these perforating branches, which is known as thalamo-geniculate branches. So this thalamo-geniculate branch, they supply the thalamus and epithalamus. They are known as this pulvinar, or this area controls the mood and this particular control of the rage, anxiety, all these regions of brain is supplied by the thalamus and their surrounding nuclei. So this region, along with this particular cerebellum, along with the brainstem, is supplied through this particular posterior cerebral artery network. Posterior cerebral network is having two arteries, vertebral artery, basilar artery, and posterior cerebral artery, which is the terminal branch of basilar artery. So this posterior artery, along with this brainstem, it supplies this part. We call them as occipital pole of the brain. So this occipital pole of the brain have got blood supply coming in this particular region from the posterior cerebral artery. Now, here we have a catch over here, over this calcarine fossa, over here in this region, or calcarine groove or calcarine sulcus, we have an area of the vision. Now, this visual area which is lying in here, which is present in this particular region, has an overlapping blood supply. So, this brain region over this calcarine sulcus have a dual blood supply receiving from this particular middle cerebral artery and the posterior cerebral artery. Now, that is why if you have the cerebrovascular accident coming through this particular rupture of the middle cerebral artery, the vision many a times is spared. We call them as macular sparing of the vision, which has been asked in examination many a time. Explain why. If you have a middle cerebral artery rupture or cerebrovascular accident, the vision or macular sparing of vision occurs. In physiology also they ask about. So that happens because the visual area near to this calcarine sulcus has a dual blood supply, which is coming from the posterior set or posterior cerebral artery and middle cerebral artery. So having a dual supply, it survives the vascular insult if it is affecting this posterior region or this particular segment. Now coming to this posterior segment, which is coming in here, penetrating branch from here or this particular central branch, which this posterior cerebral artery is giving, we call them as thalamo-geniculate branch. This thalamo-geniculate branch which is mentioned, which is coming principally from the posterior cerebral artery, this supplies the thalamus and the geniculate body. The thalamus and the geniculate body which is supplied by this particular posterior cerebral artery, and rest part which is related to the deeper part, basal ganglia, internal capsules, they are largely supplied by the middle cerebral artery and anterior cerebral artery. So this is the primary area which is related to this particular like a blood supply to the brain, anterior cerebral, middle cerebral and posterior cerebral. This yellow region that you are seeing, this domain falls into the anterior cerebral artery. This MCA, middle cerebral territory. This is posterior cerebral artery territory in regard to the cerebrum, which is related to the blood supply coming to it. This is a medial surface that you are seeing, corpus callosum related taking to it this side. It is supplied by this particular cortical branch of the anterior cerebral artery. They are supplying this medial half, the posterior half, medial side supplied by the posterior cerebral. Only this particular region, which is tentorial surface, a little part in this surface is supplied by the middle cerebral artery. Middle cerebral artery supplies deep inside this particular nuclear formations, which is known as this part, we call them as basal ganglia, as well as this network of the channel system, we call them as the internal capsule. Now, this is what we are talking here is related to the thalamus. After this thalamus, we have a chordate nucleus, putamen, globus pallidus over here, which is running in here. This region, posterior cerebral region, is receiving the blood from the posterior cerebral artery, and this artery which is supplying, we call them as thalamo-geniculate body. So thalamus is supplied with the posterior cerebral artery. This is an MCQ they ask about the thalamo-geniculate artery, which is a branch of which artery supplying to which part of the brain, and as well as striate branches which is supplying to this particular artery is coming from the which part of the brain. So this is about the anterior system and the posterior system that you have to know. Coming to the blood supply to the cerebellum, we have three sets of the arteries which are supplying the cerebellum. Superior cerebral artery, inferior cerebral artery. Inferior cerebral artery is having the two branches, anterior and posterior. All the branches of the cerebellum is coming from this cerebral artery or posterior set of the arteries, which is coming from this particular vertebral artery, forming over here basilar artery. This basilar artery sits these particular branches, superior cerebral artery, inferior cerebral artery and anterior posterior cerebral arteries. So they are supplying this particular ventral and the dorsal surface of the brain. They are coming from the posterior domain. Now coming to the final thing, which takes all the things about it. Communications between the anterior set and the posterior set, we call this as a circle of Willis, which is a bridging network of this particular vessel system, joining the right side, left side of the brain, as well as anterior portions and the posterior portions of the brain. So we have the anterior cerebral artery and the middle cerebral artery and the posterior cerebral artery. In between them, we have this communicating artery, anterior and posterior communicating arteries. They are making a network of the channels which is running in here, making a circular locations. We call them as Circle of Willis. It is nothing but they are communicating between these particular two systems. So we have the anterior cerebral artery, right and left. Then we have this particular middle cerebral, internal carotid artery, middle cerebral artery. From the internal carotid artery, you see that we have a branch which is going back. We call them as posterior communicating branch, which is joining with the posterior cerebral artery. So this particular posterior cerebral artery gets a communicating branch joining with this particular internal carotid artery, makes a bridging network of the vascular system. From there, we have this anterior cerebral artery. Right side anterior cerebral artery, left side anterior cerebral arteries. Communicated with, between them, anterior communicating artery. So this particular whole network is having a communication. So circulation of the blood can happen between the right half and the left half, anterior half of the brain to this posterior half of the brain through these arterial network channels. So this particular arterial network channel sits in the middle portions of the brain. We call them as base of the brain, and to be specific in the base of the brain, we call them as interpeduncular fossa. So in this region, we have a network, we call them a Circle of Willis. The clinical significance of that, it is communicating between the right side of the brain, left side of the brain, and anterior half of the brain and posterior half of the brain. So this is about this particular network of the system which is related to this. Now if we have this particular vascular channel or Circle of Willis erroneously dilated, we call them as aneurysm. And this aneurysm, if it is affected to the Circle of Willis vascular supply or vascular networks, we call them as Berry's aneurysm. We call them as Berry's aneurysm, which is a saccular dilatations of this particular vascular channels. So if you have this vascular channel saccularly dilated, that can lead to rupture of the vessels. We call them as rupture of the vascular aneurysm of these regions. Now if we have this particular vascular channels which is dilated in this particular region, which is the cavernous sinus region, it can poke into the optic nerve, it can irritate this particular nerves which is related to this ocular supply of the nerve. That means third nerve, fourth nerve, sixth nerve, that can be damaged or kind of irritated by this. So we may have a vision error, we may have this particular movement of the eye error if this particular anterior segment of this particular Circle of Willis having aneurysms. Now coming from this particular vascular channel, this part we already have covered, dural sinus or dural venous sinus, superior sagittal sinus, inferior sagittal sinus, transverse sinus, we already have talked about. The clinical part which is related to this, most important to the sinus, is cavernous sinus. Learn about this particular boundaries of it, relationship of this particular sinus and this particular content which is related to the lateral side of the sinus which is present to it. This is a very important exam short note or very super important exam short note which is cavernous sinus, and the clinical problems over here we call them as cavernous sinus thrombosis. So if you have an infection coming from this face region can reach to this particular region of this particular brain, we can have this particular thing. Blister of the face can lead to the paralysis of the eye movement, eventually death because of this particular problem. So this particular problem is having this particular error. Ophthalmoplegia can happen because of this cavernous sinus has a communication with the valvulus veins from this particular ocular veins to the facial veins. So from this particular face veins, it drains to this particular cavernous sinus through this particular deep facial vein through this particular ophthalmic veins eventually to this cavernous sinus, and once this cavernous sinus is breached, it can lead to the stasis to the blood flow. We call them as cavernous sinus thrombosis or cavernous sinus drainage disease error, which can affect these nerves, which can affect this pituitary function, which can affect this particular optic chiasm, which can affect the blood flow through this internal capsule, internal carotid artery as well. So, this cavernous sinus thrombosis or clinical problem related to it, very important. Please prepare this particular cavernous sinus boundaries and the contents of this particular cavernous sinus. So, do read this particular cavernous sinus as a very high yield exam short note with this clinical problem related to the cavernous sinus thrombosis. Along that, blood supply to the brain, 3 sets of artery, anterior, middle and the posterior one. Now, this posterior one coming through this particular 2 sets of arteries, basilar artery and the vertebral artery, eventually posterior cerebral artery coming from them, anterior and middle cerebral artery, branches of internal carotid artery. And all these arteries set 2 types of branches from it. We call them as central branches, which is penetrating branches. They give cortical branches, which is superficial branches. The deep branches, there are many of them. Out of this deep branches, 2 of them we have to remember, we call them as striate branches. We call them as thalamo-striate branches. They are supplying this particular basal ganglia regions, and we call them as thalamo-geniculate branches, which is coming principally from the posterior cerebral artery, supplying the thalamus and the geniculate body. So, this is in a nutshell about the blood supply to the brain and venous drainage of the brain have already been covered. Special emphasis will be on this particular venous channel. We call them as cavernous sinus. Anything and everything of the cavernous sinus is the important. So, that is it. Thank you.